Hi everyone, this is a video about MARCoNS. Just before jumping into the crux of the video, if you don't mind taking a quick second to please like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying in this video should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone posted a question on one of my other videos about MARCoNS. For folks who don't know what MARCoNS is, it's an acronym for multiple antibiotic-resistant coagulase negative staphylococcus. Essentially, it's this type of bacteria, staphylococcus bacteria, that lives in the sinuses. It's resistant to a lot of antibiotics, and it's something that commonly will affect folks who are also dealing with mold illness. And there's quite frankly debate, and shall I even say controversy, around MARCoNS. Not about its existence, but just more around its clinical relevance. I've listened to some experts, like mold experts, complex chronic illness experts, say, you know what, like I just don't even really test or treat for MARCoNS anymore because it seems to not really have the clinical relevance that I feel like it should. And then other folks are, dead set, like, yes, you must treat until MARCoNS is totally gone. It's coming up negative on a test. So it's a little bit of a tricky topic. It's kind of like around mold illness, like around the topic of a person's HLA genetic status. Some folks will say, oh, if you have this particular this particular genotype, you might as well just, like give up now because you're not going to get better. And then other folks say, like, well, it might be more of an obstacle to getting better, harder to clear mycotoxins, but you can still get better with the right support and enough work. So anyways, these are there's debates around this, shall we say. So with that preamble out of the way, the question is, so let's see here. It says, if MARCoNS susceptibility goes from resistance to 2 or more antibiotics to only resistant to 1 antibiotic, it's technically no longer a MARCoN. So yes. In your experience, do you keep treating the staph infection that is no longer considered a MARCoN until it no longer shows up on the MARCoNS test, or do you stop because it is no longer a MARCoN? Okay, and then just there's mention of being on a group talking about MARCoNS, and it says one person has cleared as MARCoNS, but it technically shows up as a negative staph that's resistant to only penicillin, and his symptoms remain despite taking VIP, which I believe you do not use in Canada. I'm not sure about the accessibility of VIP in Canada. It's definitely prescription only, and as a naturopathic doctor in the province where I practice, I'm not able to prescribe pharmaceutical medication, so I know I definitely can't prescribe it. I'm not sure if it's feasible to be prescribed anywhere in Canada or not. So thank you for the question. So to be perfectly frank, I personally feel that I'm more concerned about what kind of clinical changes are we seeing with the protocol in question. So if a person's on a nasal spray and they go from resistant to 2 or more antibiotics to resistant to only 1, so it's technically no longer MARCoNS, and the patient's feeling better on the nasal spray, then I would generally, if it was my patient, I would likely recommend they keep up the nasal spray and we kind of follow those clinical results. If a patient went from resistant to more, if their staph went down to being only resistant to 1 antibiotic, so technically no longer a MARCoNS, and the nasal spray they've been working with hadn't been helping up to that point, I would personally likely recommend that they keep going with their regimen and then retest after a little bit to see, is it making a difference if we, completely clear the staph, or see if there's any further change in terms of the status of the MARCoN, and maybe retest after a couple of months or so. Depending on how they made out with that next phase of treatment, then I'd also be always keeping in the back of my mind, do we want to be working with a biofilm disrupting nasal spray to break down any hiding places that could be a factor too? So it's a little bit tricky because on the one hand, it's like, we do want to pay attention to what test results come back and things that seem to be clinically relevant. But I think what trumps all of that, in my opinion, is what kind of clinical results we're seeing. So if I have a patient on a treatment and it's not making a clinical difference in a reasonable amount of time, and depending on what it is, that might be 2 weeks, it might be 2 months, it might be 3 months, it depends on what it is, then if the labs are changing, and even though they haven't seen favorable results, I might keep that up a bit longer and kind of follow the labs in that way. But if the labs hit a plateau, or the labs are changing incrementally, but it's really not translating into the patient feeling better, I'd be either thinking, okay, we need to switch up the strategy, maybe we need to look at biofilms or whatnot, maybe the MARCoNS is a red herring in this case, or depending on if we've already explored the biofilm side of things, I might just completely switch strategies and say, well, it doesn't look like this nasal spray is helping, so let's move on to something else. So I'm personally much more, overall, much more motivated and focused on what's happening clinically for a patient. But at the same time, the labs do inform some decision making as well. Absolutely. So that's the best answer that I think I can give to this question. I hope that was helpful. If there's any clarifying questions over and above that, don't hesitate to post in the comment section below. We're happy to chat about MARCoNS anytime. It's just kind of fun to say MARCoNS. I don't know, it's one of my favorite acronyms. So again, thank you for the question. If anybody has any questions or comments about this topic, please post in the comment section below. If you yourself have been treated for MARCoNS and you have a input on this question, love to hear what you have to say. Was clearing MARCoNS really important for you? Did it not make a difference for you? What were the things that you used that were a successful intervention for getting rid of MARCoNS? If you don't mind sharing, love to hear about that. And if there's questions about any other topic, please just post in the comment section below, and I'll do my best to answer as soon as I can.